Hi, Annie.
Hi.
Hi, I'm Robin. I'm a level 1 nursing CA, and I know you're working with a patient right now, but could I shadow you for this?
Yeah, that'd be fine. I'm actually getting ready to go in and see a patient to give some medication.
Okay, excellent. Can I get report?
Sure. I'm going in to see Mr. Ronald Jarvis. He's a 67-year-old male in room 622. He's 5'11", 171 pounds. His physician is Dr. Kay Phillips. He is a full code. He has no known drug allergies. His last vital signs were 128/70 for his blood pressure, 16 for his respirations, 76 for his pulse rate, and 98.4 for his temperature. He was at 96% oxygen on room air. His pain at that time was on 1 out of a scale from 1 to 10, and we did give him some morphine at 16:45, so that's when we last assessed his pain, so we'll be doing that again. He's a medium risk for falls. He came in a couple of days ago with a stage 2 diabetic ulcer on his right heel. Other than that, his skin is intact, warm and dry. And his blood sugars also have been running, the last 5 days have been in about the 300s. So we're going to go ahead and, his last blood sugar was 290, and that was at 16:45.
Oh, wow.
So we're going to go ahead and give him some insulin today. He does have a peripheral IV saline lock on his right median vein. He's been a type 1 diabetic for 20 years, and he's on an 1,800 calorie diabetic diet with a 2-gram sodium restriction. So my recommendation would be to go ahead and give him that insulin.
Okay.
He's got a couple of insulins ordered.
I have a couple questions for you, if you don't mind. I'm still learning all this
Sure.
stuff. So why is the client receiving this particular medication?
Well, he's a type 1 diabetic,
Mm-hmm.
and so with his blood sugars being as high as they are, he needs that insulin to help bring his glucose level down.
Oh, okay. And then, so what action does the insulin have? Like, how does it work?
Insulin promotes the storage and inhibits the breakdown of glucose, fats, and amino acids, and insulin lowers glucose concentrations by facilitating the uptake of glucose in the muscle and adipose tissue, and it also inhibits hepatic glucose production.
And when should you question giving this medication?
If the patient is hypoglycemic, you would want to question it. So you'd want to watch for diaphoresis.
That's sweating, right?
Yeah.
Okay.
Confusion, numbness and tingling in his extremities, and then, there are some other things to monitor for, but I can't remember them at this time.
Okay. And for insulin, does it have a therapeutic, serum level?
Yeah, there's no therapeutic serum level with
Okay.
insulin.
And then what vital signs are we looking at?
You'd want to watch all of his vital signs, but you really want to pay attention to his heart rate. Tachycardia is one of the side effects of hypoglycemia.
Mm-hmm.
And then you'd also want to watch his skin temperature to make sure that it's not cool and clammy.
Mm-hmm.
That's another side effect of hypoglycemia.
Okay. And what are the physiological parameters that we're monitoring?
Again, you're going to want to monitor his skin temperature, peripheral nerve sensation, his vital signs, and then watch for diarrhea and vomiting.
Okay. Those are bad.
Yeah, and you're also going to want to watch his glucose levels.
Okay. And then what interventions do we need to teach the client to make sure that the medication administration in the hospital is safe?
You want to make sure that they know what they're supposed to be taking, what it looks like, and what amount they're supposed to be getting.
Mm-hmm.
And that way they can question any abnormalities if they see anything that it's not what it should be.
Okay. And then, so is that the same as what's in the home, or are there different interventions that need to be taught to the patient at home?
Well, because we're administering the medications in the hospital, you want to make sure that they know how to administer the medications themselves at home. You also want to teach them how to clean the area with insulin, what times to administer their medications, what precautions need to be taken, like monitoring for hypoglycemia.
Mm-hmm.
And then you also want to make sure that they're aware of any potential side effects so that they can watch that medication and be vigilant and get appropriate help when needed.
Okay. And then what are the side effects and potential adverse reactions for the insulin that you're giving?
Hypoglycemia is the main one. You
Mm-hmm.
also want to watch for anaphylaxis, which is like an allergic reaction to the medication, that it can cause problems with respirations, can cause, what's the word that I'm looking for? Can cause hives, itching, pruritus.
Oh. Like urticaria, is that the word?
That's the word that I was looking for.
I think I heard Ms.
Thank you
Morris
so
talking
much.
about it the other day.
But primarily the hypoglycemia.
Okay. And then how do we know that the medication's working? Like, how do we know it's effective?
You're going to go back and check the patient's glucose level again, and you're going to want to see that it's trending back down to a normal level.
Okay. Cool. I think that's it for now.
Okay.
Do you mind if I watch?
I don't mind at all. We'll check with Mr. Jarvis and make sure it's okay with him.
Okay, excellent.
All right.
Hello.
Hi, Mr. Jarvis.
Hello.
Hi, I'm Annie. I'm your nurse today, and this is actually student nurse Robin. She's going to be
Hello.
following me today. Is that okay with you?
Sure.
Got a couple of insulins that I'm going to be giving you today. Your glucose reading when we last checked it was 290, so we want to go ahead and get that down a little bit.
Okay.
Okay. I know that you ate dinner earlier, but I'm going to be bringing you a snack after we give you your insulin.
Okay.
Okay. Do you have a preference?
I like the graham crackers if they have any.
Okay. Some graham crackers and maybe some milk?
Yeah, that'll work.
Okay. We can do that. Now, can you do me a favor and just verify your name and your age?
Ronald Jarvis, I'm 67.
All right. Thank you, Mr. Jarvis. And do you have any allergies?
No, I don't.
Okay. So I've got 2 insulins that I'm going to be giving you today. I've got your long-acting insulin, your Glargine, that we give you on a scheduled basis.
Right.
And then I've got your regular insulin, which is going to help bring your glucose down a little bit faster.
Okay.
And I did bring you some information on both of those medications, so that way if you've got any questions, you can review that, and then we can go over it later if you'd like.
Oh, that sounds awesome.
Okay. So I'll be giving you 18 units of the Glargine.
Okay.
And then with your glucose at 290, let me just check here. That's on a sliding scale, so we want to make sure that we're giving the right amount. So 290, we're going to be giving you 16 units.
Okay.
Now, where did you have your insulin injections last?
Right here.
Okay. And when you're at home, do you rotate the site that you have your injection?
Yeah, I'd just try and avoid the area that I injected last.
Okay. What you want to do is kind of go in a checkerboard pattern. Especially since you're getting more than one insulin, you want to go in a checkerboard pattern, and that helps you to avoid what we call lipodystrophy, which is where the fat tissue starts to build up scar tissue, and it actually makes the insulin absorption a little bit more difficult.
Oh, okay.
Okay. So I do have 2 injections for you, unfortunately.
Okay.
These gloves are a little tricky. I think they're a little big for my hand.
Oh, yeah?
Okay, I've got your regular insulin. And your Glargine or your Lantus, you may know it as Lantus.
Oh.
Okay, so Robin, the first thing that I'm going to do, now that I've pulled his medication, I want to double check and verify what I'm giving him.
Okay.
The first medication that I'm going to give him is going to be his long-acting insulin, it's the Glargine.
Okay.
And we're giving him 18 units. And you just want to double check, make sure that you've got the right patient, that you've got the right medication, you're giving the right dose at the right time. So we're just a little bit early, but it's okay to give it about an hour ahead of time. He's getting ready to go to bed, so. Let's see. So we've got the right patient, right dose, right time. We're going to be giving this subcutaneously and in your abdomen.
Mm-hmm.
Okay. And you said it was on the left side before, so we'll be doing
Yeah.
this on the right side.
Okay.
So that's the right route,
Okay.
and we know we've got the right drugs. So the first thing that I'm going to do is I'm going to clean the top. I'm sure you've heard clean it like you mean it.
Oh, all the time. All they teach us in level 1.
About 10 seconds usually does the trick. And then I'm going to draw up some air into the vial so that way I don't create a vacuum.
Mhm.
Draw some air up into the syringe, and I'm giving 16 units, so I'll draw up 16 units of air. Look like 16 to you?
Yes.
Okay. And you just turn that upside down. Draw up a little bit more than what you need so that you can get any air bubbles out.
Mhm.
Did you see the air bubble go back in?
Yeah, I did.
So I've got 16 units. Does that look right to you?
Yep, that looks like 16 to me.
And then you want to do the one-handed scoop method to put the cap back on. Have you heard that before?
Yeah, that's so you don't stab yourself, right?
Yes.
Okay. I hear that's bad.
And we're going to go ahead and get his regular insulin ready as well. So we've got the glargine here.
Mhm.
Try and make this as painless as possible for you, Mr. Jarvis.
I appreciate it.
Again, you want to clean it like you mean it. This one, since his blood sugar was 290, we're going to be giving 16 units of the regular insulin, and then we want to bring him a snack after we're done to make sure that his blood sugar doesn't go down too far. So I've cleaned the top of the vial. Oops. And I'm going to draw up 16 units of air. Does that look like 16 to you?
Let me check. Yep.
Okay. And again, I'm going to pull a little more than 16 to make sure that I don't have any air bubbles in there.
Makes sense.
You see 16 units?
Yep.
Okay. All right. You ready for this, Mr. Jarvis?
I guess.
So, like I was saying, you go in a checkerboard pattern, and that's what I'm going to do. I'm going to do your first injection right about here, and then your second injection right about here.
Okay.
Okay? We'll start with your regular insulin. A little pinch, a little poke. Hold it for 5 seconds. And then right
Feel a
into the
thing.
Sharps container. Wasn't too bad.
Nope, didn't feel a thing.
And you know what I forgot to do? I forgot to scan your bracelet.
Oh,
Oh, let me see that one more time.
sure.
And you are?
I'm Ronald Jarvis,
Okay, and you're how old?
67.
Scan the medication. Okay. So that one's been given, and that was in the lower left quadrant. These computers, I tell you, they're a little tricky.
Yep, technology. You know, that student nurse looks just like a nurse I had a little while ago. She was mean.
Well, hopefully this one's a little bit nicer.
But I don't think they make them meaner.
All right, so we've got your second injection. This is your Glargine. It's the longer-acting insulin.
Okay.
And we're going to give this one right about here.
Alrighty.
Want to make sure that it's about 2 inches away from your belly button when you give these injections.
Okay.
Again, a little pinch. And I know I go in at a 90-degree angle. A little poke. Hold it for 5 seconds. All right. And if I could just see your wristband one more time.
Sure. For you.
Thank you. And you are?
Ronald Jarvis, 67.
Oh, I need that bracelet one more time.
Sure.
Okay. We're all set, Mr. Jarvis. I'm going to bring you back those graham crackers and milk here in just a few minutes.
Okay.
Do you need anything else?
No, I think I'm good.
Okay, and then I'll also be back in about an hour to check your blood sugar again and see if it's gone down some.
Okay.
Okay? See you here very shortly.
All right. Thank you very much.
Okay.
Do you mind if I ask you some more questions?
Not at all.
So were there any pertinent pieces of information that you reviewed before administering the medication?
Yeah, his last glucose level was what I wanted to check to make sure that I was giving the right dosage of his regular insulin. The Glargine is actually a regular medication, so he had set at a set time.
Okay.
And then I asked him where his last insulin injection was so that I could rotate the site. You heard me tell him about the checkerboard pattern?
Yep.
That's what I would want to check for the most.
Okay. And then did the information affect your decision to give the medication?
His blood glucose level did his blood glucose level did affect my decision, particularly the amount of insulin that I gave him. So had his glucose level been a little bit lower, we may have given him less insulin.
Oh, okay. And then did the information affect how you gave the medication?
Yes, actually, his last injection site was the part that it indicated where I would give it this time. So that did affect my decision about how to give the medication.
Oh.
You want to avoid that lipodystrophy.
I hear it's not so good for the
Yeah.
insulin.
Yeah, it decreases the absorption rate.
Yeah, that's not good. I think that's all the questions that I have
Okay.
now. But thanks for letting me watch.
No problem.